We are joined by Dr. Gilbert. He is a Norwegian physician and a professor of emergency medicine at the University of Tromso. He has worked in Gaza and trained junior doctors there for the last 20 years. Doctor, great to have you here with us on TRT World. I understand you have been speaking to doctors within Gaza. What are they telling you about the current state of healthcare facilities within the besieged enclave?
Assalamu alaikum and Eid Mubarak. Thank you for having me. Yeah, I had an hour-long conversation with the Minister of Health in Gaza, Dr. Youssef Abarish, yesterday, and he tells me that there are three important problems now. Number one, the capacity. The capacity of the hospital system in Gaza is now down to around 20% of its normal capacity. They're lacking beds, and as your reporter said, they're lacking all types of equipment and medicines. Actually, in the north of Gaza, there are only 4 remaining partially functioning hospitals, and the same number in the south, 4 remaining partially functioning hospitals. And one more important thing is that there are only 8 operating rooms functioning in the north and only 12 in the south. So this is an important thing to understand, that putting up a lot of field hospitals does not help at all, because the field hospitals do not have the capacity to do major surgery. So what we need now is to repair, restore, and reopen the Palestinian proper hospitals so that they can start to function again, and not to make a double parallel system. The second problem he pointed to was the coming summer, because now summer is approaching Gaza, and with summer, the temperature will go up. There will be a massive demand for clean water, both to drink and to keep hygiene. And the sewage systems are totally broken, so the streets are flooded with sewage, and we see a sharp increase in infectious diseases, watery diarrhea, which is deadly for children, hepatitis, upper airway infections, and a lot of wound infections in the war wounds, probably 100%. So he is very concerned about the coming summer because of the lack of water and proper sewage systems. And the third thing he pointed to was that if Israel, the occupation forces, are to attack in Rafah, there will be no accessibility to hospital services for 2 reasons. After the second invasion of Nasser Hospital, it is absolutely not functioning. So Nasser Hospital is out of the question. And to get to the Gaza European Hospital, which is a functioning hospital in the south, you cannot get there if the Israelis are attacking Rafah. So this is a major concern. I think as a doctor, the only prescription I can give now is immediate ceasefire, immediate and complete opening of the siege, and to protect and restore the Palestinian hospitals. This is the only way to safeguard some sort of life-saving and treatment capacity in Gaza now.
Dr. Gilbert, the fact of the matter is that despite international pressure, growing international pressure, Israeli attacks have not stopped on the Gaza Strip. They continue. In fact, they have only intensified over the past week. Based on your conversation with doctors within Gaza, how long before the healthcare system within Gaza completely collapses? How many weeks, how many days, how many months are we looking at?
Well, I think by any definition, it has already been so destroyed by the Israeli attacks that we can say it has collapsed. It's only thanks to the heroic work of Palestinian doctors, ambulance paramedics, nurses, students, that there is some functioning healthcare system, like in Al-Aqsa and in Gaza European Hospital and in the 4 hospitals in the north of Gaza. If these attacks continue, and if we look at the graphs from the United Nations, these are the 2 graphs showing the number of killed and the number of injured. The red are the killed ones. You can see how systematic the killing and the wounding is. It's like an industrial killing and wounding machine. It seems like there is an order to maintain a certain number of killed and injured every day. And of course, as you point to, this healthcare system cannot accommodate this constant daily flow of injured, dying, and dead. In addition to the normal diseases like diabetes, like coronary heart disease, like stroke, psychiatry. So it is already collapsed. The question is, how many more Palestinians will have to die and suffer before the United States is saying enough is enough and stop the supply of weapons and money to Israel. That's probably the only thing that can change this now. The so-called international community has been a big failure. They have completely deserted the Palestinian people and all norms. I think what we're seeing now, this so-called international community has actually abdicated as a moral compass. The moral compass now is in Gaza, and we need more solidarity actions, and we need more countries like Turkey to stand up with much more firm actions. I'm very happy to see that Turkey has decided to blockade and stop a lot of export to Israel. We need more of that because that's the only language the Israeli government and the Israeli occupation forces are understanding. So this is not only a question of Gaza. This is a question of our humanity. This is an attack on our civilization, and it is a disaster by itself that this has been going on for 6 months. I mean, I've been giving interviews for 6 months saying the same things, and still it's getting worse and worse by the day. And I can tell you, the hospitals in the north, the staff there, they have to leave the hospital in the afternoon, he told me, the Minister of Health, because of fear of new attacks on the hospital, like the disastrous attacks and invasion that we saw on Shifa. So Israel seems to have as a tactique, a key part of the tactique is to destroy the Palestinian healthcare system. That's a very important part of their military tactique in order to completely destroy the civilian society in Palestine.
And Dr. Gilbert, what you just said has been corroborated by many independent human rights organizations which have documented war crimes perpetrated by Israel over the past 6 months. But I fail to understand this one thing, and I want to pick your brain on this. Why is it so hard for countries like the United States to understand the gravity of the situation Gaza is facing right now and perhaps do more to stop Israel from conducting its operation within the besieged enclave?
Well, I think there are two answers to that. And, you know, medicine is really a political science in many ways, because good public health is a question of how the society is organized. And nowhere do you see this more graphically and dramatically illustrated than in Gaza. I think the answer to your question is, number one, colonialism. This is a classical colonial attitude to land grab, to kill the indigenous people, to eradicate their culture and steal their land. The United States have been doing that for generations. In fact, the US is based on colonialism and eradication of the indigenous Indian people. And number two, a deep-rooted racism. We would never, the West would never have accepted that 70,000 white people were injured and 34,000 killed, among them 15,000 white children. Or turn it around, what would the world have done if these 15,000 killed children had been Jewish children in Israel? I mean, this is such a graphic illustration of the deep-rooted racism from the global north versus the global south, which is another part of this colonial attitude. So I think, to sum up, it is the politics of elimination, which is a part of the colonial system, and it is a deep-rooted racism against people of color, people of Arab origin, people in the global south. And this is a huge European and American responsibility, because if we cannot uproot the systematic racism, this is going to happen again. And what is going on in Gaza will determine the fate for the next generation, what will be allowed. Is it so that power shall define right, or is it so that human rights, dignity, equality, and no racism shall define right? If Israel gets away with this, we're all in danger.
Fascinating insights into the topic, Dr. Mads Gilbert. Thank you very much for talking to us here on TRT World. Really appreciate your taking out the time.